We're delighted that those of you that are here this morning are joining us. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we enjoy these educational events, and we certainly thank our associate members, and the associate members bring their expertise to benefit not only the member hospitals, but also other people that may view this, as I mentioned, online, or may contact us. I'll contact them afterwards. But today, this is being done by Texas Healthcare Staffing. They're an associate member of the Hospital Council. We really appreciate our associate members. As you know, we have 90 hospital members, but we also have about 80 associate members that bring their expertise in various areas related to things that impact the efficiency of hospitals. Staffing, I can assure you, is a tremendous area that hospitals have to focus on. Over 50% of the operating expenses of hospitals go to salary, wages, benefits, staffing. And staffing, as you know, is very complex. And depending on the acuity level, it becomes even more complex. So we're very appreciative for companies like Texas Healthcare Staffing. Today's topic is how to make in-house recruiting more effective and efficient. And that's very important because recruiting the right people and having people that deliver operations in an efficient manner is so important. So we have an expert speaker here this morning that's going to give you keen insight on healthcare employees, engaging them, and looking at it with new and innovative in-house solutions. And today, the discussion will deal with controlling labor costs and transforming recruiting and retaining employees. Today's speaker is the CEO of Texas Healthcare Staffing, Mr. Johnny Lynch. He's led the company for more than 3 years. He's also a registered nurse and has worked for more than 17 years here in North Texas in our healthcare systems. He's a graduate of Grambling State University, where he studied nursing with an executive MBA that he attained at UT Arlington. So it's our privilege and our pleasure to have not only Texas Healthcare Staffing here, but to have members of their staff, but especially their CEO. So Johnny, thank you so much.
Thank you. Thank you for the introduction, Andrew. It's people, it's networks, it's technology. Good morning. My name is Johnny Lynch, and I am the founder of Texas Healthcare Staffing. I've been working as a registered nurse for 17 years. I worked in several different departments, ICU, telemetry, med-surg, as a supervisor and as a house supervisor. I am here today to share with you a unique solution for recruiting from a registered nurse perspective. So, why is staffing so important to me? Why do I care? Well, as a registered nurse, you'll find yourself in a department where you must work as a team to get the job done. At times, you will be faced with the most critical situations, and it is extremely dangerous working with a short staff because mistakes can be made and the following could happen. You could lose your license, you and your hospital could be sued, and most important, your patient could die. This is why I care. So, I decided to solve the problem. Our number one goal for your company, to provide you with qualified candidates, retain those candidates while saving your hospital system millions in labor costs. In order to reach these goals, you have to overcome the barriers of recruiting. Our recruiting system is designed to meet and exceed today's staffing demands. From decades of experience as an employee and the owner of a staffing company, we have narrowed it down to 4 critical steps you must do to attract and retain quality employees while reducing the cost of staffing. Step 1. How to attract and engage with qualified candidates. How to improve employee retention. How to build a stronger company culture. And step 4, how to price referral compensations. If these barriers are not successfully addressed, you will have many open jobs on your job board. Our recruiting platform incorporates influencers, crowdsourcing, networking, and financial incentives to accomplish our goals and overcome those barriers. Let's discuss these 3 components. First component, influencers and crowdsourcing can be used in many different forms. For example, Apple used the method in the I Shot on the iPhone campaign. The results, 6.5 billion impressions, 95% positive comments on social media. It reached 75 countries. Apple stated it increased brand loyalty and provided social proof for the iPhone. Another company, Frito-Lay, in Plano, Texas, utilized the method in their ad campaign. They let fans create their own Dorito ads, and the winning ad was aired during the Super Bowl. The crowdsourcing program ran for 10 years straight and was number 1 over Pepsi, Coke, and Budweiser for 5 years. They spent $0 to create. Other crowdsourcing companies that you might not be aware of, Uber, Lyft, GoFundMe, and Airbnb, all successful crowdsourcing companies. Texas healthcare staffing also utilized the power of influencers and crowdsourcing to fill open jobs. Second component, networking. Thanks to Facebook with over 1 billion users and LinkedIn with over 400 million users, we all now understand the importance of networking. Texas healthcare staffing will transform the way you recruit by enhancing the networking process through the use of our algorithm. Third component, financial incentives. Texas healthcare staffing provides financial incentives to the crowd and the influencer on the platform, allowing them to determine their own income ceiling. Earning an average estimate monthly residual bonus of $200 to $2,500 or more a month. We call our platform the Employee Referral Network. How it works. You post all your jobs on our job board at no additional cost. You will have access to our candidate database at no additional cost. We will find and pre-screen the candidate for the employer. You interview and direct hire the employee. Our referral fee is a fraction of the cost of a traditional staffing agency. In closing, my name is Johnny Lynch. I'm the founder of Texas Healthcare Staffing. Our mission to provide you with qualified candidates. Retain those candidates while saving you millions in labor costs. So to get started with the retainer program or the traditional program, you might want to choose the traditional way, right? I'm available after the meeting to schedule a consultation to discuss how we can fulfill your open jobs using the Employee Referral Network. I'd like to tremendously thank all you guys for coming out. Thank you.
First came out and Uber first came out, a lot of people said this will never work, and it surely has. So you're on the cutting edge. And for many of you, you may see this when we put the link on the website, and we put this on the website. Johnny, we'll have contact information.
Yes.
Where if people see it on the website, they can contact you.
Yes.
So I'll make sure that Chris posts that at the same time. That way, people who maybe aren't physically here today will have the opportunity to contact you. But on behalf of the Hospital Council, we certainly want to thank Johnny. We want to thank you for this presentation and want to thank all of you for being here. This is a good, innovative way to look at nursing and recruiting. And as we've all discussed, it's a big expense and it hits the bottom line. So anything you can do to mitigate that expense in a positive way, not only for you, but for the employees, it's a good thing. So thank you very much.